The correlation between mental health and addiction is clear. In Canada today, millions of people have co-occurring mental health and addictions disorders. This issue is a growing concern. As the number of Canadians looking for help with mental health and addictions grows, the need to improve the quality and accessibility of treatment services to meet these complex needs is clear. While we've made some significant progress, we need to do better, especially when it comes to putting in place treatment and supports for co-occurring mental health and addictions needs. Because the reality is that for too many Canadians, these services are not easy to access. Canadians have to navigate a complex and exhausting system to access the services they need, and too often their needs are not completely met. The need for collaboration is important so that we can deliver effective treatment and support for individuals and for our communities. Across Canada, some jurisdictions have recognized this need and have made the move to combine mental health and addiction services successfully. Todd Leader is here to talk to us about what successful collaboration looks like in Nova Scotia.
When it comes to these psychosocial and behavioral and emotional kinds of issues, we have to start to recognize that it's a whole person and those pieces are integrated. From an administrative perspective, people automatically jump to the structural piece and think that, well, as long as you put those two programs together under the same director, then you're integrated and things will just happen. And that's a superficial kind of approach, and it's based on administration, not on the way people actually behave. One of the most common approaches used in this is, besides the structural piece of just creating a single directorship, is the idea of physical co-location. So you'll see people doing that as well. Just put everybody in the same building, sharing a hallway, and they will start to function as one. But there's no evidence to support that. But the real work of creating true integration actually happens at a social psychology level. It is about how groups relate to each other, view each other, interact with each other, and conflict or become one with each other. The kind of things we need to do to get past that part, after we put them together in the same space, we need to create interdependence between them. We need to create collaboration and interdependence, which really means we need to create opportunities for them to need each other, not just to work in the same hallway as each other. That interdependence actually helps them change their definition of who is us and who is them. It will mean less bureaucracy in terms of referrals and paperwork and having to go through various assessment processes. It will mean not having to go to a second person to tell your story again. By integrating, at a superficial level, we got to say, well, what would be best for the client? A single client. And it would be a single phone number. Quite simple. No confusion, no stress trying to figure out where to go. A single intake system with nice people on the phone to talk to and who can make sure that they get the treatment that they need for their variety of issues, for their combination of issues. Being able to see one person, one therapist, and unless there was some level of complexity or uniqueness that required more intensive work, then that one person is all you would need to see. And so for a client to be able to come in and just see the one person and not have referrals and not have multiple appointments and not have to tell my story to two strangers instead of one. From a client perspective, that is a miraculous change.
Recently, the Canadian Centre on Substance Abuse partnered with the Canadian Executive Council on Addictions and the Mental Health Commission of Canada to consolidate knowledge and generate consensus on effective approaches and strategies for enhancing collaboration between mental health and addiction services. This partnership led to the publication of the Collaboration for Addictions and Mental Health Care Best Advice document and an online collection of tools and resources to support collaboration. Both resources can be downloaded from the Canadian Centre on Substance Abuse website.